So tell me about Alliance Health Networks. What do you do?
We are building social networks in health, and we started in diabetes and now have the largest network for diabetics in the world. And we've started to expand into dozens of other conditions. So we build sites that speak to people based on where their health needs and interests lie. So we have sites for people with heart disease, sleep apnea, depression, PTSD, and so we have now over 50 condition-specific sites.
So if I'm a patient and I sign up for one of your sites, what kind of services can I use?
So we have access to a whole host of products and services that are designed to help people better navigate their care. And we're primarily, though, really trying to ensure that patients have a place they can turn to connect with other patients. So we are, in many respects, a vast support network. And we know from what we learn from the patients who come to our sites that what they really want is to understand how their peers are navigating their healthcare decisions. So what kind of medications are they trying? What are the different treatments that they've been experimenting with? And in many cases, they're looking for emotional support.
And I can imagine that the dialogue that goes on between patients could be valuable for research purposes. Can you talk a little bit about the data extraction that could benefit from this?
Sure. So that's a very exciting area for us, and one of the things that we've really been doing is capturing a huge volume of exchanges among patients. And in some cases, they're talking about specific treatments or specific medications. And in the last 3 months, we've started building out more capacity around deep data mining so that we can start to analyze those conversations and start to extract knowledge that we think is really meaningful from those conversations. And we believe that could really support a lot of different types of research. So there's one initiative that we're working on right now with some researchers at Tufts School of Medicine to understand what are some of the unique dynamics among patients across conditions. So for example, what do folks who are dealing with sleep apnea do on a network versus those who are dealing with depression? And what can we learn about some of those dynamics that then allow us to be more responsive to those patients when they join our sites and provide them with the right kind of information at the right time?
I see. And are you also looking into researching the effects of different treatments, types of symptoms, disease progression?
So we are beginning to do some of that. We have, in Diabetic Connect, for example, we've started to do health tracking, so self-reported health tracking. So we're getting more insight now than we have in the past as to what is a patient using, what kinds of medications are they on, are they insulin dependent, et cetera. And they're also now, of course, talking about what kinds of medications or treatments have been successful for them. So there are more ways for us to begin to mine that data, so to speak, in a totally de-identified way, so that we can just understand better what people talk about as being effective in their care.
Mm-hmm. And what has patient response been so far?
Well, anecdotally, the response is really remarkable because people will often talk, particularly people with chronic disease, as you probably know, they really have a constant battle around just feeling isolated. So when they find a network like ours, almost invariably they're really comforted knowing that there are other people just like themselves who are dealing with the condition, and now they can get some support. And we've had a good deal of more kind of anecdotal evidence that people are saying, you know, by virtue of participating in this community, I've been able to learn things about how to handle my condition that I wouldn't have otherwise known. So people start to make changes in their day-to-day behavior. In some cases through patient encouragement. They may start to exercise more, they may change aspects of their diet. And experiment with things that they haven't learned about through their care system.
So these connections that they make online can actually lead to clinical outcomes, improved clinical
Absolutely.
outcomes. That's great. And how did you get involved with building these virtual communities?
Well, I've been in the online community building world for longer than I care to admit, actually about 25 years. And my real interest has been for years, how do we take all these technologies and use them in ways that can really benefit patients? So I'd had the benefit of working with a lot of organizations that were more in philanthropy and health. And we've been incredibly excited about all the new ways patients can come together on networks to share information, to connect with others, to connect with eventually with providers. And we think that there are just huge opportunities here. So it's a very exciting time to be in this space.
Yeah. And do you guys also work with physicians as well?
We've started to do some work with Joslin Diabetes Center in diabetes. It was really our first effort to begin bringing more of the provider perspective onto our sites. So we now have 3 specialists from Joslin Diabetes Center who respond to questions from patients. And one is an endocrinologist, one is a certified diabetes educator, and the other is an RN. So depending on the nature of the question from the patient, one or the other of those specialists will field the question. And we've compiled over about 5 months now over 600 questions that other patients can now tap into and feel like, yeah, of course there are other people who have the same question I do, and they can research or just search through those questions and get the answers they're looking for.
Great. So you talked about data extraction, and you also talked about expanding into other diseases. What else is out there for Alliance Health Networks? Well,
so one of the things that we're seeing is that when you get into some of the more rare and complex conditions, cystic fibrosis, multiple sclerosis, rheumatoid arthritis, where in many cases there's a real need for close monitoring around medications and where there are a lot of different treatment options, there's a greater incentive for people to participate in social networks. So initially we were really focused in these large quote, lifestyle conditions, right, around heart disease, diabetes, and so forth. Now we really see a huge opportunity to focus on those smaller conditions, but where the patients really want to connect with one another. So we're doing a lot more now in those areas. And we do believe that over time, as we build critical mass, we're going to be able to start to look more deeply at the kinds of conversations people are having on the sites, and better understand what are the issues that they're really struggling with. How much of that is around treatments, medications, side effects. In some cases it may be just trying to navigate the system and pay for their care. And those are the things we want to learn so that we can, as I said, deliver better, more kind of personalized content to people based on where they are in their health journey.
Yeah, I'm sure that will be really invaluable for physicians as well to understand better the patient experience and how they navigate through their disease.
Absolutely.
So.
And I should say that a lot of the physicians, of course, are really trying to understand what can they do to help patients once they leave their office. And we are seeing now more physicians who are in fact referring patients to a social network to get better support. And I think that may prove to be a really important part of the system going forward.
Right. Well, is there anything else that you would like to share with our viewers?
Oh, there's probably plenty of things I'd like to share, but at this point I can tell you that this conference has been incredible because I'm seeing now, like I've had an opportunity to meet a lot of e-patients and get a much better sense of the kinds of issues they're dealing with on a day-to-day basis. And it's just reinforced all the reasons why we're doing this and how critical it is that we create even more tools and more sort of capabilities to help these folks and others navigate their healthcare journey, which we all know is very complicated and difficult.